Respiratory protection training. As your employer, Wake Forest University has certain responsibilities under the Respiratory Protection Program. It must maintain a written respiratory protection program, provide instruction on respiratory hazards, provide instruction on the use and limitation of the respirator, instruct and demonstrate to employees how to properly wear a respirator, allow employees to practice the procedures, provide user seal check instructions, fit test each employee using a respirator, instruct employees in procedures for maintenance and storage, inform employees how to recognize medical signs and symptoms that may limit or prevent effective use of the respirator, and document fit testing and training. Your health depends on breathing clean air, but in a laboratory, studio, or maintenance environment, respiratory hazards may be present. These may include dust or fumes, gases and vapors, oxygen deficiency, or extremes of temperature. Dust, fumes, and mists are tiny particles that float in the air. Though you can't often see or smell them, they can become trapped in your respiratory system and cause irritation or short and long-term health problems and death. Dusts are caused by sanding, crushing, and grinding. Fumes occur in high heat operations such as welding or furnace work, and mists are found near spraying, mixing, and cleaning operations. Gases and vapors are contaminants mixed in the air. These can irritate your respiratory system and cause short or long-term health problems or even death from suffocation. Gases are produced by chemical processing and high heat operations, while vapors can be formed from solvents, acids, and caustics in painting. Oxygen deficiency is simply a lack of oxygen in the air. Oxygen deficiency can cause you to lose consciousness or die in minutes. Oxygen deficiency may occur in enclosed areas. Temperature extremes may damage your respiratory system. They may occur in high heat furnaces or freezing processes. Remember, never enter an oxygen-deficient atmosphere without a supplied air breathing apparatus. The four main types of respirators are the half mask, reusable air purifying device that covers the nose, mouth, and chin, the full face, which is a reusable air purifying device that covers the entire face, protecting the eyes, nose, and mouth, supplied air, airline or self-contained breathing apparatus, or SCBA, that provides clean air to the user, and the particulate, disposable mask that covers the nose and mouth, effective only against particulate matter. The half-face respirator. Gas and vapor respirators have unique replaceable cartridges that capture gases and vapors from the air. A pre-filter may be attached to the cartridge to trap dust, fumes, or mists. A half mask won't work properly unless it's properly fitted to your face. Perform a positive and negative fit test before entering a hazardous area. The full face respirator is like the half mask, but with the addition of a face piece to protect the eyes and face. Cartridges contain chemicals to absorb gases and vapors. Again, a pre-filter may be added. Though the concentration level of gases, vapors, and particle hazards are reduced, these do not protect against oxygen deficiency, temperature extremes, or hazards not listed on the cartridge. The supply-aired respirator provides additional head, eye, and face protection. Airline respirators will supply the user with clean air, temperature-controlled from a hose. Self-contained respirators allow for greater mobility, protect the user from oxygen deficiency, temperature extremes, and high concentrations of dust, fumes, mists, gases, and vapors. So make sure all parts are working properly before entering a hazardous work zone. The particulate respirator. The N95 is the most common of the 7 types of particulate filtering facepiece respirators. This product filters at least 95% of airborne particles, but is not resistant to oil. It is also not effective against vapors or mists, and should be replaced after each use. Medical assessments are used to ensure the user is physically capable of wearing the respirator. An initial assessment is performed prior to the first use of the respirator. The type of respirator to be used and the environment in which it will be worn will determine the extent of the physical. An annual medical surveillance will be performed for those individuals required to wear respirators as part of their job function. A reassessment should be done prior to using a respirator if the user's health has changed in any way that may affect the ability to use the respirator. Always take the following steps prior to using a half mask, full mask, or air-supplied respirator. First, check your equipment. Before each use, check the respirator for signs of wear or damage, and never use a respirator that is in need of repair. Facial hair around the chin and cheeks can interfere with a respirator seal, so shave prior to using a respirator. Follow all provided instructions for donning the respirator. Instructions may differ between manufacturer and device. Perform a positive pressure test. With palms over exhalation valve openings, exhale gently into the mask. You should feel pressure in the facepiece. Perform a negative pressure test. Place palms over the cartridge openings and inhale for 10 seconds. You should feel the mask pull in toward your face. And finally, the fit test. A documented fit test using an approved qualitative or quantitative technique must be performed prior to the initial use of the respirator. Cartridge replacement schedule. Cartridges or canisters can only absorb a limited amount of hazardous gas or vapor. To ensure your protection, they must be replaced before they reach this limit. This is known as a change-out schedule. You must be provided this information so you know when a cartridge or canister must be changed. Never rely on your ability to smell a contaminant to warn you of cartridge or canister failure. If you smell a contaminant while wearing your respirator, leave the area and notify your supervisor immediately. Half and full face respirator cleaning and storage. Wash your respirator in warm water and mild detergent to sanitize. Inspect your respirator regularly for damage. Store it in an airtight container in a clean, cool, dry place. Replace cartridges as needed and notify your supervisor if repairs are required for your respirator. For a supplied air respirator, check all parts of the system including the respirator mask, hose, regulator, and tank or compressor. Check the certification date on the tanks. Use sanitizing wipes on the face area and store in a clean, dry place. Breathing is an essential part of life. If you have concerns or questions, contact your supervisor or EHS before you use a respirator. Thank you.